Skin cancer is the most common cancer of all, more people get it than any other type. And most of the time it's very treatable. But hidden within that reassuring picture is melanoma, a much less common form that is far more dangerous, and one that has become a showcase for the most exciting advances in modern cancer treatment. Understanding the difference could genuinely save your life. Let's clear up the categories, because the word skin cancer covers very different things. The two common types are basal cell carcinoma and squamous cell carcinoma. Together these make up the vast majority of skin cancers. They arise in the outer layers of the skin, typically on the areas that get the most sun, the face, ears, neck, and hands. The good news is that they grow slowly and locally, and they very rarely spread to the rest of the body, so they're rarely life-threatening. But they do keep growing and can damage tissue if ignored, so they still need to be removed. These are the skin cancers most people will encounter. Then there's melanoma, and this is the one to take seriously. Melanoma begins in the melanocytes, the cells that produce the pigment that colors your skin, which is why it often appears as a new mole, or as an existing mole that starts changing. It's far less common than the basal and squamous types, but it accounts for the large majority of skin cancer deaths. The reason is simple and dangerous. Unlike the common skin cancers, melanoma can spread early, traveling to the lymph nodes and then to distant organs while the spot on the skin still looks small. Caught early, melanoma is usually cured by simple surgery. Caught late, it used to be one of the deadliest cancers there was. Because catching melanoma early matters so much, there's a simple checklist worth memorizing, the ABCDEs of moles. A is for asymmetry, one half doesn't match the other. B is for border, the edges are irregular, ragged, or blurred rather than smooth. C is for color, there's more than one color, or uneven shading. D is for diameter, it's larger than a pencil eraser, though melanomas can be smaller. And E, the most important, is for evolving, any mole that is changing, in size, shape, or color, or any spot that's brand new and looks different from your others. If something on your skin fits these, it's worth having a dermatologist look. Removal and examination of a suspicious spot is quick and low risk. Here's the part that makes melanoma one of the most important cancers in modern medicine. Just over a decade ago, melanoma that had spread was close to a death sentence, measured in months. Then it became the proving ground for immunotherapy. Drugs called checkpoint inhibitors, which release the brakes on the immune system, produced something almost unheard of in advanced cancer, lasting remissions, with some patients still cancer-free many years later. On top of that, about half of melanomas carry a specific mutation in a gene called BRAF, and targeted drugs that switch off that mutation can shrink tumors dramatically and fast. Between immunotherapy and BRAF-targeted therapy, melanoma went from hopeless to a disease where long-term survival is real. It's the clearest proof of what the new tools can do. So the takeaway splits neatly in two. On prevention, the overwhelming driver of skin cancer is ultraviolet exposure, from the sun and from tanning beds, so sun protection, shade, and skipping the tanning bed genuinely lower your risk, especially the cumulative damage that adds up over a lifetime. And on detection, because early melanoma is so reliably curable with minor surgery, the single highest value habit is simply knowing your own skin, noticing change, and getting anything suspicious checked promptly. Skin cancer is the cancer you can most often see with your own eyes, which is a real advantage, if you use it. This is educational, not medical advice.